did my presentation on the urinary system. The urinary system filters waste from blood and eliminates it as urine. And so here's a little diagram here of the kidneys where the urine is made, and then it comes down through the ureters into the bladder, and then the sphincter muscles are going to contract, and then it leaves through the urethra. So after you consume food, your body is going to take in all of the nutrients it needs, and excess waste are then left behind throughout your blood and in the bowel. The urinary system works with other organs that excrete waste, such as the lungs, skin, and intestines, to keep a chemical water balance throughout the body. About 1.5 quarts of urine is excreted each day, and the urinary system also works to eliminate urea that is carried in the bloodstream to the kidneys. Urea is produced when foods containing proteins such as meat, poultry, and vegetables are broken down in the body. And then the kidneys remove urea from the blood through tiny filtering units called nephrons. And so here I have a picture of the parts of the nephrons. This is the cross-section of the kidney, and then unfiltered blood is coming in, and then filtered blood is coming out, and then the urine is coming out through here. And then up here is a nephron, and it's going to come in this little glomerulus where the filtered blood goes out, and then the unfiltered blood is going to come in, and then it's going to go through the tubule, and the urine is going to leave from there. And a nephron contains the glomerulus, which is a ball formed of small blood capillaries and a small renal tube, and urea is what forms urine. So from the kidneys, the urine travels down the ureters to the bladder, and they are constantly contracting in order to force the urine down. And a kidney infection may occur if the process isn't constant. So if it were to come back up, then that's when an infection would occur, because the urine then becomes toxic. And so a normal bladder should be able to hold 2 cups of urine comfortably for 2 to 5 hours. And actually every 10 to 15 seconds, some urine is released into the bladder, and nerves then carry signals from the brain to the bladder and sphincter muscles, and then the urine is released and the pattern begins again. So sometimes there can be problems with the system, usually caused by aging, illness, or injury, and then over time muscles begin to lose their strength as you get older because they've been used for so long. So it's harder to contain your bladder, so that's why people in older age have incontinence issues. Urinalysis studies the abnormalities of the urinary system, so that's just going to be the typical urinating into a cup. And then the urodynamic test evaluate the storage of urine in the bladder and the flow of urine from the bladder through the urethra. And this test is going to be more complicated and is done by inserting a catheter into the urethra and then through the bladder, and another tube is then inserted through the rectum to measure the strain on the bladder. And so here is a diagram of the water that's going to be put into the bladder, and then it's going to test through here the amount of pressure. And so then here's some graphs of sample readings of what's normal and what's abnormal. So my main focus point is going to be on kidney stones. And a kidney stone is a hard mass formed in the kidneys, typically consisting of insoluble calcium compounds. Here is the kidney right here. There's going to be the urethra and the bladder, and the ureter is where it comes down. And then here is the kidney cut open, and an example of the kidney stone, where it would be inside the kidney. Although it's going to vary just depending on the stage in which the kidney came in. So stones usually form in the kidneys or bladder when the urine becomes concentrated. So this allows the minerals to crystallize and stick together once the urine is concentrated. It's often very painful to pass kidney stones, but they usually don't cause extensive damage. Normally you can pass a stone by just drinking a lot of water and taking some medication. Although if the stones become stuck in the urinary tract, surgery may be needed. And here is a chart that I have representing the prevalence of kidney stones between male and females in the United States, and it's based on the body mass index. And so for normal, overweight, and obese, male always lead in the number of kidney stones that they have, so it is more prevalent in men than in women. Symptoms of kidney stones usually don't occur until the stones move around within the kidneys or the ureters. Some are going to include severe pain in the side, back, and below the ribs, pain when urinating, pain cloudy urine, nausea and vomiting, and the continuous need to urinate. And the intensity of pain is going to change just based on location of where it is. So here's a picture here of the common areas of where pain for kidney stones may be. So there are three main types of kidney stones. There's no definite cause of the stones, but there are many different types of them. The most common is the calcium stones, and they're in the form of calcium oxalate. And oxalate is common in vegetables, fruits, and nuts and chocolates. Your liver is also what's going to produce the oxalate. Dietary factors, high doses of vitamin D, intestinal bypass surgery, and several metabolic disorders may increase the calcium or oxalate in urine. Here's a picture right here of the calcium stone. And then there's going to be the struvite stones, which form in response to infections like UTIs. And these are rapidly growing at a quick pace with little symptoms. And here's the struvite stones. And then there's the uric acid stones, which form when people don't drink enough, if people lose too much fluid due to dehydration, people with a high protein diet, and people with gout. And gout is a disease in which defective metabolism of uric acid causes arthritis. So kidney stones, you're at risk for them if your family has had stones, if there's a history with them, or if you've had them throughout your life at all. If you live in a warm climate or you sweat a lot, you're at risk because dehydration often causes kidney stones, so it will increase your risk. If you eat a high diet in protein, especially sodium and sugar, the risk is increased. If you have a high body mass index, and if you have undergone gastric bypass surgery, have inflammatory bowel disease, or other problems in the digestive process. So determining that you actually have a kidney stone, your doctor may require that you have blood testing to monitor the amount of calcium, uric acid in the blood. Urine testing is commonly used, so that's going to be like the bean in a cup sort of deal again. And then imaging tests are often performed to show kidney stones, and this could range from an X-ray to a computerized tomography, which is just going to be a CAT scan, so it's going to give you bigger details than what an X-ray would give you. And ultrasounds could be used, and then there's intravenous urography, and that's going to involve injecting dye into your veins and then taking X-rays as the dye moves to the bladder and kidneys. So here's an example of this, how the dye is going to be injected, and then you're going to go under one of the machines like this, and it's going to be able to show greater detail. Treatment for kidney stones, if you have small stones with little to no symptoms, they're going to have you drink a lot of water, about 2 to 3 quarts a day, and that will help release the stones from your system. They can also tell you to take pain relievers such as Motrin or Advil to relieve discomfort, or they may prescribe you alpha blockers, which may be given to relax your muscles in the ureter and help the stones pass faster with minimal pain. If you have larger stones with more apparent symptoms, this is going to be when the stones are too large to pass, they cause bleeding or consistent UTIs. There's a few different treatment options for that. First, there's the sound waves, which may be used under a procedure called extracorporeal shock wave lithotripsy. And this creates strong vibrations that are going to crush the stones. So here's a picture of this here, how the shock waves will break up the stones in the ureters. And so you're going to be laying on a table like this again, and then there's going to be the vibrations that are going to crush the stones. Sometimes there's going to be other procedures such as surgery, which is they would do a small incision in your back and then they would take it out that way. They could do a scope, which they would insert the tube and then break it loose and then crush it from there. Or they could do parathyroid gland surgery, which would only be used if you have overactive parathyroid glands. So in order to prevent kidney stones, they suggest you drinking lots of water, eating calcium-rich foods, avoiding high oxalate foods. There's a big list here of different kinds like tofu, wheat, and then having more things like bananas, water, coffee, broccoli, yellow peppers,